For that. At this stage, let me just take a check. I would normally, after a couple of hours, suggest an adjournment, but I see that we've 2 items further on the agenda. Would people be comfortable that we should continue? Okay, thank you very much. The next item is the revision to the board committee structure and corporate governance framework. Did you wish to? We'll invite Karen to speak to the paper. Thanks, Karen.
Yes. So we had a previous discussion about this issue at a previous board meeting, and we've been doing a review of the board committee structure as recommended by the board to try to streamline the committees and ensure that they are fit for purpose, having obviously moved on from the first year of setup of the organisation. So we've carried out that review. We've also taken into account the board effectiveness review that Margaret Exley has carried out, as well as input from NEDS and from internal audit. And as you know, we are making recommendations about changes to the committee structure, which help to streamline all of our activity, and to also raise the committees up to a more strategic place in support of the board functions, which is really important. So I think this has given us a great opportunity to re-clarify what our committees are there for, and to help the board to do its work and to make sure it's focused on the strategic agenda. And obviously, going forward, we'll want these committees to have the 5-year forward view very much in their sights and be looking to see how they can map and support that work. So I wasn't going to go through each of the specific recommendations in here, but what this paper does is set out the specific terms of reference of each of the committees as now defined. It also attaches recommendations for the changes to standing financial instructions, SFIs, and overall board delegations. And those have been mapped into the committees to enable that to work effectively. I'm conscious that there are some changes to those which emerged late and so aren't reflected in the paper. They're not substantive in terms of the content of the proposals for the board committees, but they are important because they do affect the delegations in particular to some committees, and so we will need to change the papers to reflect those. So firstly, I'm looking for the board's approval of the specific recommendations around the terms of reference and the accompanying SFIs, though those need to be amended. Secondly, about how we implement these. So we are very keen to implement as quickly as possible. And some of the recommendations can be implemented immediately. So, for example, the move to the Strategic HR and Remuneration Committee can be put in place immediately. Other committees, we absolutely need to go through a process where we have a conversation with each of the chairs of the committees and ensure a proper handover of business into a new committee and ensure that that's managed effectively. So some of the committees will take a little bit longer to explicitly work through. And a third element of implementation, which I'd just like your support for, is that we are, one of the precepts behind this review is that we ensure that we're not asking board committees to do the work that the executive should be doing and that you should be looking to the executive to assure you of. And the next piece of follow-up work that we need to do is to properly review all of our executive committee structure, which provides the board with appropriate assurance from that structure as well. So those are probably the main points that I wanted to ask for the board approval of today.
Well, thank you very much, Karen. I need to just assure the board. We did commission from Margaret Exley a review of board effectiveness. She hasn't yet reported, but I'm expecting a final report from her shortly. We will be having a time-out of the board later this month, and I propose to take that report as a framing for the remainder of the business in the time-out, which will be very much around the 5-year forward view. But the checking that I've done with Margaret is that what we're proposing in committee structure is entirely convergent with her report. She also, I think, will stress to us that the committees, each of them, are an outreach of the board. They are the board doing business on behalf of the board. Therefore, it's board business, it's not executive business. And that distinction between executive and strategic, I think, is going to become even more important for us to maintain over the coming year as we work on the 5-year forward view. Thirdly, what I would like to invite the board to do in a moment, subject to comments on the paper, is to authorise some further minor amendments to be made. I know, Paul, that you have some concerns about some of the financial delegations. We need to incorporate that and ensure that we've got the attunement and the alignment absolutely right. But before I put that question to the board, let me invite comments on the paper. Noel.
As you said, Karen, the architecture of the committee structure is very much looking forward to how best it can support the implementation of the 5-year forward view. It's likely that one committee will see part of a proposal, for example, the financing part. Another committee might see the operational part of the proposal, and who knows, it could end up in a third part too, through the strategy committees. Do you think that the mechanism of cross-representation is going to be sufficient to enable the joining up across committees of some of the large initiatives that come through? Or should there be something more than cross-representation as a mechanism to join up?
So cross-representation will clearly help, and I know, Malcolm, you were aiming to bring together the chairs of the committees on a regular basis as well,
yep,
in order to ensure that we could cross-reference agendas and major pieces of business as they come through the committees. Clearly what we would expect as well is for the board supports and national directors. Of course, all papers that go to committees will come through our executive structure, and it will absolutely be the responsibility of the national directors who are leading in support of the chair of each committee to make sure that we have a consolidated proposition that comes to each board committee rather than 3 separate ones.
Right. No, and I think that is the assurance that you need. I think there are various other ways. That what I would like to propose, and it's in the paper, is that each committee agenda and papers are put on an intranet where they can be accessed by every member of this board, so that we have a joining up of intelligence. Secondly, I think it is appropriate to suggest that every non-executive is entitled to attend any committee meeting, if there is, I think, benefit to be had from going and seeing what's being done in investment, for example, alongside one's concerns around specialised commissioning, then that would be entirely appropriate. But I go back to Karen's answer to you, which is actually, it's the responsibility of the national directors to make sure that there is joined up and that there is proper oversight that we as non-executives can exercise over the process.
Malcolm, sorry, just to build on that, I think the other thing is that the fact that something's being done in a committee should not presuppose that it's not discussed at the board. You know, there will be quite a lot of things that where some of the heavy lifting will be done in the committees, but the aggregate of importance, that's a subject for the whole board.
What I'd like to suggest on that, what I really don't like is bringing the minutes of committees to boards. I just don't think that's appropriate. What I would like to bring to the board, as we have today, is a brief report from each committee, but with the right of the chair of that committee to talk to the board, but actually not just to do a routine report. I mean, we need to have business coming out of the committee to the board for further deliberation, having had prior, shall we say, digestion in the first stomach of the board, which is the committee. Right, I won't take that any further. Are we content? I'm sorry. We are content. Okay, we are content. Right, well, on that happy note, I'm going to ask you to endorse the proposals in the paper, but with a view to the executive doing some further minor alterations to it. Thank you very much. We come now to item 12, board committee feedback. As I said at the outset, the items are starred. The only item which I would like to invite the presenter to make a comment on is quality and clinical risk, and to welcome Sir Cyril Chartler. Cyril, thank you very much, not only for coming here today, but also for your chairmanship of this committee. May I invite you to present your report?
Well, thank you very much, and indeed it has been a pleasure. I've enjoyed the last year. Our report really concerns our last meeting, which is in September, and you'll have read the report, so I won't go through it. I would only like really to discuss one item, and that is the seminar and the subsequent conversation we had about the outcomes framework. Now, I think the NHS outcomes framework is an excellent foundation for improving, for judging and improving quality in the National Health Service, and I think it's widely regarded throughout the service and indeed internationally. I know it's being reviewed at the moment, but I hope there won't be substantial changes. I think the conversation we had last time, where we discussed Domain 1, was probably the most important topic we've discussed over the year. And we had planned to go on and look at the other domains, and indeed the next one we were going to do, which is very important, is long-term conditions, where we've been particularly interested in how you measure value. Value being outcomes per pound spent over a period, say a year in the life of somebody with multiple chronic illnesses, which is at the core of the problem for the National Health Service. We preceded the conversation this time with a seminar led by Professor Nick Black, and next time we still plan to go ahead in December the 1st with a seminar which will be led by the people running Domain 2, Martin McShane within the NHS England, but also UCL Partners. And if anybody wants to come to that meeting at 1:30 on December the 1st, they'd be very welcome, because I think it will be quite informative. We have a capacity in this country to do something no one else in the world can do. We have a registered list. It means that we can capture outcomes and we can capture costs with full regard for patient confidentiality, so that we can measure outcomes per pound spent. This conversation this morning about waste in the National Health Service. Well, you've got to be able to measure to judge that, and we need to be able to measure everything we actually do if we're going to improve it. And so I commend this work to you for the future. Now, as far as the meeting we had on December the 1st, I'm afraid it's not all good news. The outcomes in this country are not as good as they should be. There is something called preventable mortality, which is a public health issue and about healthy behaviours, and if we don't tackle that throughout the service, we're never going to have a sustainable health service. And that's very clear from the 5-year programme, and I think it's page 9. It's really important. And we saw in our conversation the information about tobacco, alcohol, obesity, and the lack of physical activity. And that has to be the responsibility not just of Public Health England, but all of us who are involved in providing healthcare to the British people. There's also amenable mortality. And amenable mortality is deaths which seem to be unnecessary and related to poor health care. That is a concern for NHS England. And although there's been dramatic improvements in outcomes over the last 30 years in the National Health Service, and we should all be pleased and proud about that, and people are living so much longer, nonetheless, in relation to other countries, we have not done very well. And in children, I'm afraid, and I speak as a paediatrician, our results are appalling. We are now have the worst immune mortality of any of the 15 plus European countries, and although again things have got better, they haven't got better fast enough. There's a report recently published from the Royal College of Paediatrics and Child Health and the National Children's Bureau, which points out that there are nearly 2,000 children each year who die, probably unnecessarily, but certainly in relation to mortalities, for example, in Sweden. And so we need to approach those issues and deal with them over the years. And hopefully we are going to make progress on that. One particular concern is sudden death from asthma. And so I think there's much more to be done. I think progress has been good. And I do hope that the board will continue to look at quality outcomes in this way. Thank you.
Well, so you remind us of one of the main reasons that we're here, and we're very grateful to you for that. The 5 domains are absolutely critical for everything that we do, and of course are part of our mandate obligations. But what you talk about in terms of amenable mortality, I think is of huge substantive interest to us. That Lancet paper of 2 years ago, which looked at the EU 15, demonstrates that not only is the UK did it not only start off below the European mean, but actually fell further down over the past decade. So I think there's an enormous amount of improvement to be done. Against that, we do have teams, of course, working in each of these domains. Bruce may wish to say something about the work that's going on. I think from the board's perspective, the critical thing is how do we assure ourselves as to the clinical risk, as to what's occurring, and how do we ensure that when we come to report next against the mandate, we are on track and able to record improvements. But perhaps Bruce might say a little about the way in which the domains work through his medical directorate.
Thank you. The outcomes framework was developed with the intention of doing 2 things. Firstly, of helping to turn clinical outcomes into the currency of business for the NHS, because it is clearly what is of interest to patients, and it's clearly why people working in the NHS go into work. And it's based on 3 areas, which are around our definition of quality, which is that no organisation or individual is offering a quality service unless they offer an effective one, a safe one, and one that's as decent an experience as possible. And it's based on an observation that any healthcare system in the world should do 5 things. It should stop you dying prematurely, and you've alluded to that in your remarks. It should look after you well if you have a long-term condition or a chronic illness. It should look after you well if you have a short episode of care from which you're going to make some recovery. And those fall into, if you like, the domain of effectiveness. And then it should look after you well if in as decent a way as is possible, and that means in part issues of courtesy, hospitality, and decency, and at another level it means giving patients some say in what treatments they receive, when they receive them, and how they receive them. And then there's the issue of delivering safe services, which means essentially the patients accept that their disease has got a risk, they accept that the treatment will have a risk, and they often have to make trade-offs between the two. What they should never have to accept is the way that we organise and deliver our services adversely affects that. So we have within each of those 5 domains a set of very high-level measures which we use to monitor, if you like, the progress of the NHS. We've tried to keep those measures to around about 50 initially. They've crept up to of the order of 60 now. But most of them are aimed to give us a long-term view of the trajectory of the NHS, and they're aimed to do things in a slightly different way. So what we want to do is we want to align the whole of the NHS behind those high measures, and different people will make different contributions to them depending on the nature of the service in which they work. And we also endeavour to link the aspirations that are outlined in the outcomes framework into our contractual and payment processes. And that's how we're aiming to try and turn clinical outcomes into not only a hardcore currency for the NHS, but to align people's goals, because we'll get a much greater synergy if everybody working in the NHS, irrespective of whichever tribe they work for, is aiming for the same set of goals. And that's something that we haven't always achieved over the history of the NHS.
Thank you, Bruce. I mean, so we on this board have this constant tension, inevitably, between inputs and operational on the one hand, and outcomes on the other hand. It's the outcomes for which we were primarily set up and instructed to deliver. Let me take some further comments from Kieran, John Byrne.
And Victor was the third non-exec in the room at the time. For me, that session was the most powerful session I've had as a member of this board, because it was taking the overall outcomes framework and saying, where are we good, where are we not good, and what are the limited number of things which, if we actually move the dial on, that we would have a disproportionate impact on outcomes in this country. So for us as a board, in how we make our decisions around priorities, not understanding this for domain 1 or its equivalent for domain 2, 3, 4 and 5, I think would be remiss, because how we commission and what we commission has to be informed by this. So I would be supporting, I think maybe one of the things Cyril is alluding to is, maybe there's a board development session in this about truly understanding this data, because lots of other things we do, if they're not informed by this, we're leaving half the equation out. So knowing what we know now, and this is almost a quote from somebody in the room, if we were in this room in 5 years' time and we had not addressed some of the things which were in that presentation, we should be asking questions of ourselves, and certainly other people should be asking questions of us as well. So it was a hugely important presentation, and was the first time that I began to see how Bruce's work and Jane's work links to some of the stuff in the forward view around what models do we need to deliver these things, because if we're going to deliver the forward view, why wouldn't we do it here first? Because we'll have a disproportionate impact, which then feeds, we create the virtuous circle. So for me, it was the most important presentation I've seen, and I think we all need to understand it, but John may have a different view.
No, I agree. Actually, I wanted to ask Cyril. I mean, I attended the meeting in September and was very impressed by his skillful extraction of interest from a very eclectic group around the table. You've obviously given great thought to this committee and we're keen for it to go on. You, I suspect, may be disappointed that it's been restructured. My question to you as an observer of this complex organisation is, are we addressing the needs in the new structure in the way that you would have aspired to address in the old?
I think at my age one's never disappointed at being decommissioned, so I don't think you need to concern yourself with that. No, I think this should be an executive concern, not a non-executive concern. I don't know what plans the chief executive has for taking that forward, but I would ask him very seriously to consider that, and I have written a little note about it.
I look forward to receiving it.
Your chairman's got it.
I've got it. So I will act as postman to the chief executive. So, thank you. That was actually a high note for us to end this meeting on this morning. And, can I, on behalf of the whole board, thank you so much for all the work that you've done for us over the past couple of years. It's hugely appreciated.
Well, I've learnt a great deal. I've enjoyed it. Thank you.
Thank you. And can I, before I close the meeting, also just to report on any other business, that our next meeting will be in London on the 17th of December. And on behalf of the board, to thank John Schick, who's been our board secretary for 2 years, yes, for all that he's done, and wish him well in the next phase of his career. Thank you, John.
Thank you.
If there's no other business, there is none. I declare the meeting closed. Thank you very much indeed.